The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, today on Aging Horizons we're still coming to you from the 50th Annual Governor's Conference on Aging in Helena, where we've had some great speakers, some great events, lots of fun and lots of great people to talk to and learn from. Today we're going to be talking about ACL, which is the Administration on Community Living. You want to know all this, so today stay tuned.
The face of the American workforce is changing. People are healthier, living longer, and living better. Baby boomers are a valuable resource for the workplace of today and tomorrow. They're still active and eager to help. Experience, dedication, wisdom, these are just some of the significant assets older workers bring to the job. Age is an asset, experience a benefit.
Don't forget, today you're going to Grandma's house.
Oh man, I better grab a jacket. It's always so cold at Grandma's house.
I know, honey. Grandma and Grandpa are having a hard time keeping the house warm lately with all the medical bills.
Oh really? Are they gonna be okay?
I think so. They're going to ask Energy Share for some help.
Energy Share, helping Montanans facing energy emergencies. 1-888-779-7589.
We've been married for 57 years, and we've always been very, very close. And Bessie fell and broke her hip, and we put her in the nursing home. And I wanted to get her out of there in the worst way, because we married for better or for worse, and we're going to stay that way. And the personal care that comes in here and gives us a hand is equally as important as I am to her. Personal care is the answer to it all, and without it we couldn't do it.
Good care is your right. In Montana, there's over 11,000 beds in nursing homes and assisted living facilities. If you or a family member needs assistance or help in obtaining information about care issues and placement options, call 1-800-332-2272. If you or a family member need information about Montana's long-term care resident rights, or if you need help solving a problem or a complaint about a nursing home or an assisted living facility, call us at 800-332-2272.
Hi everyone, and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Kimmy Everman, and as I've been saying on Aging Horizons, we're here at the 50th Annual Governor's Conference on Aging in Helena. We're having a great time, we're learning a lot, and we've had some really great presenters. With us today is Barb Smith, and Barb is the Administrator of the Senior and Long-Term Care Division for DPHHS. Welcome, Barb.
Thanks.
Nice to have you here, yeah. Now, so we had some really great speakers and guests at the conference this time, and one of the gals was from ACL, which is Administration on Community Living. Now, we're going to talk to her later, but I wondered if you could talk about how we at the state level work with ACL, which is a federal organization.
So in the Senior and Long-Term Care Division, we house the State Aging Unit, and that's where we receive a lot of funding to make sure that people get home-delivered meals, they're safe in their homes, they have access to information, they have access to socialization, and a good backbone to those programs is what ACL helps us with. So they have the same goals we do, make sure people are in their homes as long as possible, they know how to get to resources, they enjoy living, and you know, they're not subject to elder abuse and scams that we hear so much about. So that's sort of how we mirror one another.
Okay. And how we work with grants from the ACL, and that means we have different projects going on.
Yes, we do.
What do we have coming up in the future?
So we get a lot of funding from the Administration on Community Living, because it also is the pipeway to our Older Americans Act money.
Right.
So what's coming for us in the future? You know, we're finishing out this year. We have 1 year left on our state aging plan. So we're looking at those programs of home delivered and congregate meals, and where do we want to go with that? Right. You know, what is new at the federal level? What is more of an innovative way to deliver meals? And especially for us, because as many of our viewers know, we don't exactly live in populous areas.
Exactly.
So that's one area where, you know, we will be looking at things differently. And as we go through that aging plan process, ACL supports us.
Sure.
They help us get data, they help us get research, and so that's the next big thing coming up for us.
Well, and what kind of research do they help us with?
Well, they help us through their research arm, which has a long acronym that I frankly don't remember.
Well, and I didn't even know there was a research arm, so.
So what they have is the most current research on aging and disability living services. So living in a sense that you're still in the community and what is happening in across the nation, what is working and what is not working. Mm-hmm. And we really need to take advantage of that across all our programs. Right. So I'm excited to be able to get in there and dig in, and well, you know me, that I'll just keep digging in.
Yes, indeed.
And then say, hey, I have this crazy project. So we'll be looking at that resource more and more.
Yeah. And you know, speaking of the research, we do work with ACL and use their research for our information. Does that sort of help us figure out what services we can offer?
It does. It can help us define where our biggest weaknesses are, and maybe that we need to shift some of our focus, which would mean shifting some of our resources. Right. It also helps us tell the story of what's happening in the aging community and the disability community in Montana by telling our story to the feds and, frankly, telling our story to the state legislature.
Right. And why is it so important to tell our story, Barb?
I think for us, there's two reasons that's very important to tell our story. And one is, you know, we have done some really great work out in the field and with our Aging Bureau staff of getting people knowledgeable about what's available as you age. And the second part is taking a big leap from that and trying to be more innovative on how we do things, take advantage of technology, build bridges across all our systems. And ACL has much research and funding that can help us get there.
Right. You know, and they're going to be speaking at our conference this time around. You're going to be there?
I'm going to be there. I get to introduce you.
Yeah, and they're they have always interesting topics that we can talk about. And I know legislature is coming up very soon.
Very soon.
Right?
Start to plan.
Yeah. And will that also help shape our plans in terms of what's coming up?
It will help shape our plans in the terms of what our needs are. It's sort of like we're doing our state plan that we need to give to the ACL at the same time the legislature is happening. And on one hand, we had the oh no moment. Right, but we'll actually be able to get that research, get our statistics out. You know, the programs we have a lot of statistics, and that'll not only help us tell our story, but it'll also help ACL continue the fight on the federal level to make sure we get appropriate resources.
Well, and also I think to understand our story, because we frontier rural states are a different animal.
Oh, they are.
Than some of these folks have ever seen before. They often come from the city and have never experienced the miles and the windshield time.
I do have to tell you that one of the last conferences I was at, there was a speaker up and they said, rural does not equal remote. I was like, excuse me, really? Not necessarily. So it is very difficult for sometimes individuals who have never experienced the Montana back roads, or trying to figure out how to get services to the guy on the third ranch over to the back. It's hard concepts for them to know. And I think Mary will get to understand that since this is her native voyage to Montana.
Well, and we're lucky we're going to have Mary next up to talk about some of that stuff. Barb, do you have hope for the future with Aging Services?
I do have a hope for the future. We've got a great team here, and we've got some good stuff on our plates, and you'll hear more from us.
Great. Well, thanks, Barb. And thanks to all of you for staying with us, and we have more, so stay tuned.
Suddenly, I couldn't speak.
I knew something was wrong. I called 911 immediately.
My arm didn't hurt, it just stopped working.
I knew the signs of a stroke. I called 911.
Know these warning signs, and if they happen to you or anyone with you, call 911. Treatment within 3 hours from the start of symptoms can make a difference. Stroke is a major cause of disability. It is also highly preventable. Learn the signs and act immediately. For more information, call 1-888-4STROKE.
You mean I can get help paying my prescription drug premiums?
Let me get this straight. I could be eligible for help with my family's prescription premiums even though I own my own home?
And our assets won't be counted.
If you're a Montana resident enrolled in the Medicare prescription drug program, you could be eligible for help paying your premiums. Call or visit the Big Sky RX website today to find out, even if you think you're over income.
What do you know about that? I'm eligible.
All right, I'm talking with Duncan Adams from the Attorney General's office. Duncan, something that's happening during this crisis, this foreclosure crisis, is that there's scams out there. I mean, hard to believe that people would take advantage of someone that's already down, but it happens a lot, doesn't it?
It does happen a lot, and they're pretty blatant about it. There are I've heard advertisements on TV and on the radio for people that are scam organizations. You really need to be suspicious when you find stuff on the internet. Want to be really suspicious if you find somebody who's willing to help you for money up front. That's usually a big red flag. We're able to help all aspects of our program, and we're free.
Right. So essentially they're saying, hey, we'll take this load off your shoulders, we'll fill out the paperwork, we'll deal and negotiate for you.
And they'll be really easy to get a hold of at first, and then they'll just disappear.
Boy, be suspicious of that. And remember, this is a free service. KeepMyMontanaHome.com.
Hi folks, welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Kimmy Everman, and as I said in the open, we're here at the Governor's Conference on Aging, the 50th annual. We're having lots of fun here in Helena, and we've had a lot of chance to learn and have some great guests with us. And one of them is with us today on the show, Mary Lazare, and Mary is the principal Deputy
Administrator.
Sorry about that. With ACL, and ACL is the Administration on Community Living. And so, with that, Mary, I'm gonna toss it to you. What is ACL?
Sure. Glad to tell you a little bit about ACL.
Yeah.
So ACL is the Administration for Community Living. ACL was formed back in 2012. The Health and Human Services agencies of the Administration on Disabilities and the Administration on Aging were combined. So our advocacy efforts around older adults, along with advocacy and services and interventions for people with disabilities, were brought together under one agency. Over time, the portfolio that ACL has includes as well a research center. So
I didn't know that.
Yes, the National Institute on Disability, Independent Living, and Rehabilitation Research,
okay, that's a mouthful,
albeit NIDLR, was added to ACL in about 2015. So what that brought to us is a focus on people with disabilities across the lifespan, youth, young, all the way to older adults.
Yeah.
So people with disabilities aging, as well as people aging into disability. NIDLR puts a focus on how do we help people with disabilities live their lives now.
Right.
So it doesn't focus on, 10 or 20 year, what's the cure for, but rather how do we help people live with disabilities right now. So it's interventions and research is to impact us on an ongoing basis. So having it as part of ACL gives us the opportunity to share emerging issues from aging and disability stakeholders with our research center. As an example, we've also added to the portfolio, what has been added is Limb Loss Center, Paralysis Resource Center, and Traumatic Brain Injury programs. So all of this makes sense to bring it all together.
Absolutely, it does.
Address all of this. And now what we focus on is cross-pollinating all of us, sharing the knowledge, transfer that knowledge from one expertise side of ACL to another. So we don't necessarily even talk about sides, but how do we approach this? Our mission is to enhance the health, well-being, and independence of older adults, people with disabilities across the lifespan and their families and caregivers. So we also recognize families and caregivers.
Oh, huge.
Huge issue. Over 43 million caregivers out there, and the issues are immense. And so we look at helping people stay in the communities. We realize caregivers are the backbone, the linchpin of the long-term support system.
Right.
So if we want to keep people, older adults and people with disabilities, as independent as possible, engaged in community life, we need to support their families and caregivers as well.
Yeah, absolutely.
Yeah, so all of that work is coming to fruition, and what's wonderful about that is, as well as within the Department of Health and Human Services, we're able to incorporate all the human service side aspect of health care. So what's important is that people not only get care and procedures, but get the ongoing supports to keep them out of institutions, prevent hospitalizations. So we know that transportation is key, to access nutrition, to access. So all of these aspects of older adults' needs and supports, as well as people with disabilities, are intertwined, and we all gain and learn from each other, and the expertise becomes even more pronounced.
Yeah, you explained it beautifully. I had no idea about all the research and everything, and you're right, that intertwined different groups of people and issues, excuse me, is the only way to really do a good job, because everything is intertwined in the real world.
Everything is intertwined in the real world, that's right. And so ACL's also put its focus is advocacy across the federal departments and agencies, so that we bring to others, Department of Transportation, Department of Labor, all of them, Department HUD, Housing and Urban Development, the needs of older adults and people with disabilities. Our role is advocating for them across all federal agencies.
Well, and again, to talk about it from that real world perspective, that one-stop shop kind of concept is fabulous, especially in a state like Montana, where there's a lot of miles between places to go.
And I have learned that today. I learned a lot today in terms of, certainly you have frontier areas, you have rural areas, and so getting people access to services, getting support to families and caregivers so that they can continue to provide what they provide is a challenge in a state like this.
It is.
But you've also pioneered in many aspects as well. So we applaud Montana on a lot of those programs, like your nutrition program is one where partnering with prisons to provide meals, because they can do it less expensive than some of the other opportunities that were available, stretches your dollars further.
Yeah.
So ACL uses that kind of information to spread to others, to make those kinds of programs that are scalable, get that information out to people.
Sure, because it could work for some other state, or maybe tweak it and work for another state.
Keep the innovation coming, right?
Right, exactly.
Keep the innovation coming.
Exactly. Well, that is some really great education, Mary. Thank you so much. Folks, we have more to talk about. It's really important that you know where to go for resources when you're an adult with disabilities, or a senior, or a family, or a caregiver. So we want to help you out with that information and get you as much as we can. We have a whole lot more coming, so stay tuned.
Crackling fire, good warm. Forest fire, bad warm. Keeping the home fires burning, good warm. Watching the home burn, bad warm. Your family deserves the kind of warm that comes from being able to pay the heating bills. Whether you're a homeowner or a renter, the Low Income Energy Assistance Program may be able to help. Call today to find out if you're eligible. We can help you get comfortable with winter's high energy costs.
Montana is a very rural state with very small communities, and I think it's very important that we get it out in those smaller communities that yes, our older adults are having falls. It's very important to prevent these falls, and now we have a program, Stepping On, that can help them with that and teach them to have a better quality of life, live longer independently by themselves or with their spouses. We can use the Stepping On program to help prevent those falls and to make people's quality of life better.
I'm Attorney General Tim Fox. Nowadays, all of you have to worry about cybersecurity. Something as simple as visiting pirate websites can put your computer at risk. Hackers use pirate websites to infect your computer and steal your ID and financial information, or even take over your computer camera without you knowing it. Don't let hackers into your house. Be careful with the websites you visit and warn your kids on how to stay safe online. To learn more, visit my website.
Are you sure you can see?
Yeah.
Are the headlights on?
Yes.
Do we need chains?
No.
Need to slow down?
You know, you're probably right.
Winterize your vehicle, then winterize your mind. Stay clear of snowplows until they pull over, and it's safe to pass. Drive safely and arrive alive.
Hi everyone, welcome back to Aging Horizons. We're here with Mary Lazare this morning at the 50th Annual Governor's Conference on Aging in Helena. And we've been talking about ACL, very important for you to know about. It's the Administration on Community Living. We just had a clarification of what ACL is, but Mary, do you have knowledge of any priority areas for ACL? What do they want to be working on?
Oh, absolutely. I'm glad you asked that question because we actually have five, our priority areas are called pillars.
Okay.
So we have 5 pillars that ACL has identified, and those 5 pillars are areas where, not to discount everything else that's important,
right,
but these are priority areas that need additional focus, some additional synergies and passion.
Sure.
So those 5 I'll describe for you. The first one is strengthening our networks. So our networks are all across the country.
Mm-hmm.
We have aging and disability service organizations. These are tribal organizations, faith-based organizations, state and federal, AAAs, area agencies on aging, all of them providing services and supports to individuals and their families and caregivers. So we call these our networks. In some states, these are known as no wrong door systems.
Sure,
They're
yeah.
model systems.
Mm-hmm.
And here in Montana, the AAAs, 9 out of 10 have adopted that thinking where they've provided the training to all of their service organizations such that an individual knocks on any one of those doors, they get access to the information they need.
Which is the way it needs to be.
Which is the way it needs to be. It's a great model. So Montana's done a fabulous job of pioneering and forging in that regard. So strengthening our networks is one of those.
Okay.
We look to find ways for those networks to be part of, integrated into the health system in a county, a state. For example, state plans, managed care plans, health systems recognize that it's not just the health interventions, the procedures.
Right.
It's the human services side.
Right.
So even our department, Health and Human Services, putting those together is what's key. So we want to strengthen our networks to help them understand and be able to speak the language of why are we important to you health plans,
Sure.
health systems,
Yeah.
and be
Makes sense.
involved.
Yeah.
To give them that business acumen and so forth. So
Yes.
that's one of them.
Okay.
Another one is providing support to families and caregivers. So as we've discussed, they're the linchpin
They are, yeah.
of
that's
long-term
true.
services and supports.
Yes, yeah.
There are 43 million of them. It's a value of $500 billion worth of care that's given across this country by that
Unpaid
support system.
is what you're
Yes.
saying. Yes, okay.
That's the value of it. So we have to support it because we're that linchpin to get pulled and taken away.
Right.
That's critical.
Yes, it's going to...
And in a state like Montana, to not provide support to these families and caregivers who are out in rural areas, where
Right.
I was just speaking with someone a minute ago talking about assistive technology, how difficult it is to get some of that to people
That's
in
true,
rural areas, and what a great addition that can be in helping families. So it's important for us to recognize that need as well. So that's
Okay.
another need.
Okay.
Another one that is also important, and this rings true for anybody who hears this, is preventing fraud and abuse.
Oh, absolutely, yeah.
So we know that older adults are certainly prey for
Right.
people for financial abuse.
Right.
And what's interesting at this point in time is the opioid crisis makes this even, a nuance on this whole issue of fraud and abuse with elders is such that older adults, because of the chronicity of their conditions and multiple conditions, there's more prevalence of opioid use with older adults because of pain management and some of their other issues.
Right.
The fact that that prevalence exists, their medicine cabinets are targets for people who take medicine that the older adults should be taking, so that certainly impacts them. Number two, we have people misusing them. Sometimes that's their children or grandchildren. If it's their children, we're often finding older adults, grandparents raising grandchildren.
Yes, yeah.
So we're not only talking about children serving older adults, but older adults also becoming caregivers. Right. So we know that all of this opioid issue has created a problem for us in terms of fraud and abuse.
Sure.
So we look to certainly put a lot of focus on that, trying to develop and strengthen an adult protective system that targets, focuses on older adults across the country.
Yep, you're right.
Yet another one is also increasing employment opportunities for people with disabilities and older adults. We know older adults, many of them, not all, but many of them want to continue working.
Right.
We want to be able to support that.
Right.
And some of them need to continue working. So again, tying that back to our mission, enhancing the health, well-being, and independence of older adults to be able to live in the community. We want to put a focus on that. Some people need to work to pay for food, housing,
medicine,
medical care, medicine, all of that. So all of that is important to us. And then certainly connecting people to resources.
Oh, yeah.
How many times have we heard, oh, if I had just known about that.
Right.
If we had known that that resource existed or that service existed, that would have helped us so much. It's disheartening when we hear that. So we want to do a better job of making sure that when people need supports and services, they know how to access them quickly.
Right.
And so that's where we've put an emphasis on those 5 pillars. And in addition to that, we've created teams within ACL to put a focus on them, and those teams to identify some strategic areas and work with stakeholders and others to put some synergy into all of this.
Mary, great. This has just been a great segment. Thank you so much for telling us all about ACL. I certainly learned a lot. And folks, like Mary said, don't wait till you're in crisis. Reach out. We want to help you. We want to support you. For Aging Horizons, I'm Kimmy Everman. Thanks for being with us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.